This conference will now be recorded.
Good morning, everyone. Tammi, are you ready?
Yes, ma'am.
Okay. Take it away.
All right. 1 second. All right. Good morning, everyone, and thank you for joining us for this meeting of Coastal Georgia Indicators Coalition. I'll give the report. We're glad to report that CGIC has been able to bring Rachel McConaughey up to a full-time employee as of May 1st, 2021. So Lizann now has someone to help her full-time. The board has approved to have a financial audit of CGIC. When we have audited financial statements, it really provides assurance to funders that the organization's operations are free of material misstatements, and it shows the organization's integrity and willingness to be transparent to its donors. We ask for your continued support of Coastal Georgia Indicators Coalition, and we hope that you or your organization will make a contribution to help sustain the work of CGIC. And that's all I have from the executive leadership report.
Thank you, Tammi. We're going to back up one step before we get started to presentations. We sent out the minutes earlier, and so we want to make sure that we are not missing anything. Rachel, if you would bring those up a little bit closer. So the meeting minutes were sent out. Did anyone have any amendments that we need to make to the minutes? Hearing none, can I get a motion to approve?
So moved.
A second?
Second.
Okay. I know it's always hard to vote, but if you have any objections, please let them be known now.
Can you hear me?
Okay. If you would be so kind as to mute yourself if you're not presenting.
But there is an issue.
Otherwise, I have the power to mute you, which I'm doing now. Okay. All right, I think we're ready for our first presentation. So this is going to be a combo between Tammi Brown, and then we're going to work straight into Dr. Elsie Smalls and Nichele Hoskins, who are going to be talking about vaccine efforts and trusted voices. So Tammi, if you would begin, and Rachel, if you could pull up her slides, that's great. Thank you.
All right, good morning again. I was just going to give an update from DPH on the COVID-19 vaccine and our testing efforts. Next slide. So we're still offering testing at the Civic Center. It's free. The testing's being done now through a lab called Mako Labs that we've partnered with. They're testing Monday through Friday from 8:30 to 3:30. And the first and third Saturday of each month from 8:30 to 11:30. There's no appointment required, and right now, results are coming back in 24 to 36 hours. Next slide. We have a lot of vaccine available. in Chatham County. We are now doing all of our COVID vaccinating at our annex building, which is the former employability building at 1249 Eisenhower Drive. We're not doing any at the health department at the moment. We are offering Pfizer every day, Monday through Friday, and that's indicated for age 12 and up. And we've added the J&J 1-dose vaccine on Monday, Wednesday, and Friday, and that's available for those 18 years of age and up. And we have several mobile testing sites throughout the county. We've partnered with CORE, and we'll talk about that a little bit more on the next slide. Next slide. So CORE stands for Community Organized Relief Effort. And this is an organization that was founded by Sean Penn. And so they have done for us, we've partnered with them so that they can go out into the community to do pop-up sites to areas that are hard to reach, to underserved populations. They can do groups as small as 10 to 15 or large groups. They've been very flexible. They're very willing to go wherever they've been needed to go. They've gone to barbershops, they've gone to churches, they've gone to a youth shelter, several local businesses, and they've recently partnered with the Rotary and Georgia ports to go on some of the ships that come into the port for those seamen who are unable to leave the boat in order to come into the health department to get vaccines. They'll go right on the ship and do that for them. They're also at the Civic Center every Thursday, picking up where Hospice Savannah left off. So it's been a really great partnership with them. If any of you have any organizations or any groups that you would like for them to set up a clinic anywhere in Chatham County, you can reach out to me and I can put you in contact with them. Next slide. And this is just some data as far as our percentage of residents who are vaccinated. The White House has set a goal of 70% of American adults with at least one dose by July 4th. This data is as of May 27th, and as of that date, 39% of Georgians have received at least one dose of vaccine, and 32% of Georgians are fully vaccinated. For Chatham County, it's a little bit less. 36% of Chatham County residents have received at least one dose. 31% of Chatham County residents are fully vaccinated. So we still have a lot of work to do in our county. Next slide, please. This is some data of the vaccine by age. More than 80% of residents that have received the vaccine are over the age of 65, which is good. But what we're seeing is that vaccine acceptance decreases dramatically with age, and higher percentages of positives are coming with that age group of 40 and under. So that's a group that we really have to work hard with. We're working on compiling data for the younger ones, 12 to 14. But I will say that at the annex building, we're seeing lots of young people come in to get vaccinated in that 12 to 14 or 12 to 15 age group. And even more so now that school is out, we're seeing lots of teenagers come in. We're encouraging the younger residents to get vaccinated so that they can get back to some sense of normalcy, to protect themselves, their loved ones, and to reduce the risk of variants in the community. Next slide, please. Nearly 40% of females have had at least one dose, 33% of males. 21% of Hispanic residents have had at least one dose. And if you look at the graph below, you can see for other races where we are with the vaccines. Next slide, please. So again, we have lots of vaccine available in Chatham County. If anyone has an organization or a group that they would like for CORE to come and do a mobile pop-up, please put it in the chat box. I'd be happy to put you in contact with them. And then for other providers, there's vaccinefinder.org, outside of the county. And that's all I have, unless anybody has any questions. Thank you so much.
I just wanted to mention that a couple of things as we're getting Nichele and Dr. Elsie Smalls ready to present. If you would make sure you put your name and organization in the chat. And when you're over there, there is, Nichele has put in a survey link, and I'll recopy that and put it in again for everyone. So this is a survey that we want to make sure that everyone has the opportunity to take. It tells us the reasons that people have gotten the vaccine, and it also gives an opportunity for people to share where their decision making is on getting the vaccine. So if you could please do that for us. Nichele and Dr. Elsie, are you guys ready to pick up? We can't hear you. Let me see if I can. Elsie, I can't hear you. And you're not unmuted. Nichele, could you start?
Sure. Good morning, everybody. While Dr. Smalls gets unmuted, just a brief introduction. I am a communication manager for the flu COVID grant, and Dr. Smalls is the operations manager for the flu COVID grant. And we have been working since October in the area of seasonal flu, but as of April, we started working, as many of you know, in the area of COVID. And CDC didn't actually say this, but it seems as though they were giving us a warm up to working in the area of COVID when we started working in the area of the seasonal flu. Dr. Small, are you up and on? Well, as she continues, speaking of that survey, one of the really important things that we are doing is learning more about the attitudes of people in Chatham County about the flu, as Lizann mentioned. And we would hope you could push this survey out to folks so that we can learn even more. We are in the period of needs assessment and working with Lizann and with Virginia to get these questions answered so that we start from a point of knowledge to start addressing these issues. And that's going to be even more important as we, as the mass sites begin to close, and we have to do more outreach, as CORE has done, going to specific points and reaching people where they are. So when I posted that survey, I was able to click into it, although the survey was kind of washed out. So thank you, Lizann, for reposting that for us. We have gotten the survey out to JC Lewis, where we have a survey box set up. And if you need our QR code, if you can use the QR code to get people to take our survey, we'll be happy to share that with you as well. So, and by the way, my email address is nichele@healthysavannah.org. So I'll try to stand in for Dr. Smalls. What she was going to begin to discuss is our work, our other kind of work, which is to train community ambassadors, community health ambassadors. And we haven't given this group a name because we want the group to name themselves. We are trying to let them know that people in the community know that what we want to do is to really build trust and help earn the trust of folks who may be considering who are considering getting the vaccine but may be waiting a while for more information. This ambassador program would reach out to people in the community, people who are already familiar faces and trusted voices in communities, and ask and supply them with information to share in their communities. And I stress this as often as I can. It's not really, we're not trying to just merely get needles in arms. We want to increase access. We want to increase awareness, and ultimately, we hope acceptance of the vaccine. Now, I have a video that I may or may not be able to share. Rachel and Lizann, is there a way I can try to share my screen?
You're the presenter, so yes.
Okay. Oh, okay. Let's see. Let's see if this will work. Screen broadcast.
Nichele, are you okay? There we go. Nichele, is it spooling on your side? Nichele, I'm not seeing it on your end. It came out and then went. So is there a link to it? And now I'm not hearing you. Dr. Smalls, can we unmute you? I know that you've called in, so can you try unmuting yourself there? I don't see where you've called in. Are you caller 2? Let's see.
All right, I'm back.
All right, hold on just a second, Nichele. Elsie, are you there now? Can you say
Yes,
something?
can you hear me now?
I can hear you now, yes.
Are you getting an echo? I'm getting an echo on my end.
I just muted you on your device, so that should help.
Okay. Great. Good morning, everyone. We're definitely having some technical problems this morning, but Nichele has done a great job of covering where we are in terms of the implementation of the grant. As she mentioned, the surveys are on the street, and we're asking everyone, we really need to get the surveys into the hands of our priority population. We've gotten some great feedback. We have the link and access to the survey on Facebook. We've, as she mentioned, at the health department, and we're asking partners who serve our priority population to take that link and distribute it to the people that you serve, as well as to employees who might be able to give us some feedback, because some of the information that we're getting indicates that there are employees, of course, in organizations that are opting at this point not to take the vaccine. And of course, that's a choice that everyone needs to make. But our goal is just to get additional information, clarity, and give a voice to folks who might need to hear more about the vaccine or understand more about the vaccine. So again, we ask that you would help us in getting that survey out to as many people as possible. As Nichele mentioned, we are pushing and developing the program for our trusted voices, ambassadors of the community, still working on that. But the week of June 7th through the 15th, we will be doing some listening sessions in the community. And the purpose, again, is not to build this program out of our understanding of what we think we need to hear or what the community needs to see or hear, but we want their voices to help us inform how that program looks, what it needs to say, who needs to say it. And so that's what those listening sessions are about, is to get the voices of the community to help us develop and structure the Trusted Voices program that will carry us throughout this grant. So that's just some general overview. Again, we're continuing the implementation stage, and we're excited about where this is going, because it's clear that we certainly have a lot of work to do. Are there any questions for me?
Thank you, Dr. Small. So I'm going to turn it back to Nichele for a moment, and then we'll move forward. Thank you for calling in.
Thank you.
Thought you had a problem. Nichele? There we go. Hi, Nichele.
Hi,
There.
thank you for your patience. I am. Can you hear me?
Yes.
Okay. Well, thank you for your patience. I'm sorry the video will not play, but I'm happy to share it with you. But basically what it's doing is to tell you what we're telling community members what we hope to do. We decided to use video form because we can send emails. We will send an email invitation to many of the people we hope to invite. And this is not an exclusive club. If you know of someone who is particularly effective in the community, whether it is by talking with 2 or 3 people, or talking with an entire congregation or their entire social club. We want to get their names and ask them if they will help us build this program and help us reach people in communities. We will be able to choose over the 18-month period. We'll be able to choose as many as 65 people to work with us, and we will be able to give them a $500 stipend. So just to acknowledge the time and the effort that they will put in this work. So if there's anybody who has a question for me or Dr. Smalls, we're open and ready to answer if we can.
Thank you.
Thank you.
Rachel, could you pull up the link again? I'm sorry, the agenda. Okay, so our next presenter is Jacky Jackson. And Jacky, if you've got slides, do you need to be the presenter, or are you going to let us know what you need?
I do have slides. Let me.
So you should be the presenter now. Thank you.
Okay, yep. Can you see that okay? Are you able to see my screen?
Yes.
Okay, awesome. Thank you for having me today. I know some of you, in fact, probably a lot of you, have heard parts of this discussion over the past 8 or 9 months. So I appreciate you listening for a little bit longer. But we're getting towards the stage where we really need public input. So additional public input on specific portions of the chapter. So as those who might not be familiar, I'll bring you a little bit up to date on what the comprehensive plan is and what the process is. And I guess I failed to mention, I'm Jacky Jackson with the Chatham County Savannah Metropolitan Planning Commission. So we are in charge of the long range plan for the jurisdictions that you see up here on the screen. We are working for unincorporated Chatham County, City of Savannah, Garden City, and Pooler. And our plan 2040, as you can imagine, is looking out towards the next 20 years for these jurisdictions. Let's see, hopefully. There we go. The MPC, as we're known by most folks, handles a lot of services, and was just generally going to give you an idea of kind of what all is under our umbrella, so and why we're involved in this process. But as you can see from the icons up here, we look at everything from long-range planning to GIS, inner workings behind the scenes with 911 and fire, police, all those kind of things. Everything from historic preservation efforts on the local level to transportation and large corridor efforts on a regional basis. So we've got our hands in a lot of different things. What I wanted to do was kind of give you a background for those who aren't familiar, kind of set the tone for what I was going to go over a little bit, and give you some statistics on Chatham County and Savannah. I was going to narrow it down a little bit. Chatham County, as you can see, obviously for those that are familiar, we include 9 jurisdictions, and we've got roughly 290,000 people within Chatham County over the 433 some odd miles. We've got projections for where Chatham County will be over the next 10 to 20 years, population-wise, and we've got those on the screen. The population in 2030 is projected to be around 315,000. And then in 2040, we're looking at around 335,000 people within the area of Chatham County. And what this really equates to is us adding almost 45,000, actually more than 45,000 people over the next 20 years. So over time, since 1960, we've seen a 54% increase, and we're going to continue to see an increase in population within the county over time. So what I wanted to do is kind of narrow it down. So again, you'd have an idea of what we're focusing on specifically. As I mentioned, we're looking at other jurisdictions, but just for this particular presentation, I wanted to go into some statistics and just some data that we've been pulling for our long range plan. So I was specifically going to highlight the city of Savannah. Savannah, as called out, is roughly 108 square miles, and we're looking at around 145,000 people, which equates to about 1,390 people per square mile. We've seen a lot of growth over time. However, in the big scheme of things, it's kind of been steady. Since 1960, we were around 149,000, and we're actually a little bit less now at around 145,000, as I mentioned. Our median age has changed. We're now at 32.6 as our median age within the city of Savannah. And roughly, as you can see with the bar chart here, we're still pretty somewhat stable within that 18 to 64-year-old range. We have grown quite a bit, or not quite a bit, let me take that back. We've grown 5%, which can equate to quite a bit over the past 19 years. And then kind of given a breakdown between our demographics with regards to white, black, Hispanic, Asian, etc. You can see that the numbers have changed a little bit between white and black over time. But what we have seen starting to grow is that population of Hispanic, Asian, and then those listed as others. Our household median income is pretty interesting statistics, and those definitely have changed over time. Even over the past 19 years, we've seen a pretty dramatic change between those numbers over time. And this shows actually the city and the county. The county is in blue and the city of Savannah is in orange. The county, what we're basing those numbers as being higher numbers because we're taking in those island regions as well as Southbridge, the landings, etc. But then again, this is county as a whole as well. So you're taking in all the other jurisdictions in addition to city of Savannah. Poverty by race is a really interesting number to take a look at. This is the most recent across the board estimates from the ACS for 2019. Of course, you can see a dramatic difference between Black and Hispanic population persons in poverty versus Asian and white. And that's something we definitely are tracking and paying attention to for sure. Median gross rent, and this is where we start talking about housing. We've been tracking this for, as you can see, this is just within the past 5 years. We have more numbers, but you've seen a definite increase between 2014 and 2019 in the median gross rent for those in our community. This next slide has a lot of numbers on here, but the one I really wanted to call out was the one in the bottom right-hand corner. And that states that 56% of renters are cost burdened. And what that means that 56% of those who are renting are spending more than 30% of their household income on housing, which is just a dramatic number as a whole. So our building permit trends, I apologize, my slides, all the font seems to be messed up and I apologize for that. Our building permit trends for the city of Savannah have been consistently, growing over time. We've seen residential increase as well as commercial. And as you can see in 2020, actually the commercial pretty much was cut in half. However, the residential still had a pretty continuous number throughout COVID even. And that's a pretty interesting statistic to follow. And we're continuing to follow that, of course, throughout COVID. So the big question is, where does all this growth come into play? What is this helping us figure out? What do we need to be tracking over the next number of years? And the comprehensive plan is that vision document for our community. It is, as I mentioned, a guiding document for the next 20 years. And with this particular document, we are following those trends that I kind of highlighted just a minute ago. But we also looking at land use decisions, historic preservation, natural resources, and housing. So there are very specific elements that that's what we're calling them, that we're following and reporting on in this document, but then also giving our insight as to what things need to be and will look like within the next 20 years as a whole. So there are specific elements, as I mentioned, that are required actually by the state of Georgia. This process is mandated and overseen by the Georgia Department of Community Affairs. And as you can see, those elements highlighted in yellow are those required elements that the state really enforces us to report on and work with the local community as well as the local governments on. And that includes, as I mentioned, everything from economic development, housing, transportation, you name it. But however, City of Savannah and then all the other jurisdictions, Chatham, Garden City, Pooler as well, are really going above and beyond. And to ensure we are having a public process, transparent process, and to really build on our plan, We are including components such as community health, education, public safety, and then a long-term work program as well. And something else that we're really looking at including are themes within all these different elements that you see here on the screen. And that is inclusive of themes of resiliency, and can mean different things according to the topic, of course, for local government. Climate change, which really has not been addressed in the past, comprehensive plans, and then COVID-19. As planners, as community members, as residents, we know that COVID-19 has dramatically impacted our community like hopefully we will never see before. So it's important for us to document what things have been impacted and then possibly what we need to change as we move forward in our community. This whole process is governed by a goals and strategy process. Basically, as you can imagine, there are overarching goals that the community and the elected officials want to see come into play and accomplish over the next 20 years. And then we have those strategies that are meant to implement those individual goals. So through this process, there's been a very specific timeline that we've had to meet. We've been working on this since about the end of last summer. Around September of 2020 is when we started really diving into this process. As you can see from the timeline, we are moving ahead. We've had a lot of behind the scenes research. We've done a lot of engagement, community outreach as well. And now we were asking for input on the individual elements that I mentioned, basically the individual chapters. This whole process is required to be completed by October 31st of this year. And we have really started to get the elements out there and really are pushing for community input, as I mentioned. During this next couple of months, though, we will be sending drafts up to the state and city council for review and county commission for review and et cetera. But there's still a number of months for folks to provide input and feedback, and that's what we're, again, really pushing for. As I mentioned, these are some of the key dates, and you're more than welcome to, I'll send these out as well if you're interested. But the end of the month is when we start presenting some of our drafts to the MPC, and then we'll from there take it, as I mentioned, to City Council, County Commission, up to the state, back and forth. So it's a pretty in-depth back and forth process. But again, October 31st is our timeline. What I've got on the screen right now is some ways to hopefully stay involved and comment on the chapters and the elements. I've also got an image on the bottom left-hand corner that is what we're calling a comment map. I've included the link on this page as well. And a comment map was created through this process, and it's a geo-reference tool. It's anonymous. Anyone in the general public and residents, whomever, can go and find an actual location on this map and provide a comment or provide an issue or maybe provide a recommendation. And we've gotten almost 350 comments so far throughout all different areas of Chatham County. So this information is then being pulled together and either disseminated, to the county, Savannah, Chatham, or excuse me, Garden City and Pooler, so that information can be taken specifically into account, whether it's something small or we pull it into the comp plan itself. If the ideas, work with what we're trying to accomplish. So what I wanted to do was, again, I've also got our website up here where you can stay in tune to what we're working on. And as elements are completed, the drafts are completed, we're populating them on this website. And you're able to go into the drop downs for Garden City, Pooler, Chatham County, and Savannah as a whole. But again, also the comment map is a tool that we're keeping up as well. This page here just kind of lays everything out with ways to stay in touch. We also have a direct phone line where you can call and give direct comments on our answering machine, and when we're checking that daily for ideas and just general feedback or requests. We're taking requests for meetings as well in person if you give us a little bit of a heads up. We've got an email address up here, plan2040@thempc.org. As a way that you can directly email my team with any comments or feedback as well. And again, we've got a really strong presence on social media, and that's been really helpful throughout this process. In addition to radio, TV ads, hard copy, you name it, we've tried to push it out there through this process. And that's it, kind of short and sweet, but really this was just a reminder. I know, as I mentioned, a number of you have heard this this spiel for the past number of months, so I appreciate you working with us. But it's really, we're getting to that point. We want you to be able to read the document and start commenting on specific aspects of the document itself. And I did put the link to the website at my check-in on the comments. Let's see, and I will add that again for those who might, in the chat box, sorry, and I will add that again for those who might be interested in any information. And I can send out, I know there was a request, I can send out a copy of the presentation to Lizann and Rachel as well, so that if you're interested in any of the data or links within the presentation, you're more than welcome to get a copy of that. That's all I have. Any questions?
I would like to say, this is Lotus Johnson, and I would like to say that this has been an excellent presentation. I've learned a lot about where the MPC is in its planning, and I have a couple of questions. Number one, Lizann,
Sure.
does the CGIC have access to this data presently?
We have access to most of the data. One of the things that I would mention is that we too have been in the process of updating the blueprint. And so we've been cross-pollinating between MPC and CGIC, and we've been providing data to the MPC for their processes, and then they have also included their planners alongside us as we're updating the blueprint, so that we're making sure that we're linking pieces together.
When is the date for the blueprint to be completed, the revision of the blueprint?
Our intent is to have it completed by the end of June, if not before. We're meeting with each of the priority teams, and then our plan is to have a presentation to the commission, I believe the second week of July. And so that's where we're going with that. What I would say is that we want to make sure that we incorporate any community input that MPC has received to help us to make sure that we're getting those public comments, and then also the same thing would apply once we get to the commission, any input from the commission. And I think then the next piece is, given where we are with COVID, before we button everything up, to get out into the community for some community advice on the blueprint, because while they track very close to each other, our goals and strategies are similar and then sometimes different, just based on the nature of the plan. So did that answer your question, Dr. Johnson?
Yes, ma'am.
Okay.
Well, thank you. I appreciate it. And I will go ahead and, oh, you know what? And I failed to mention too, I apologize. I will send the presentation out to Lizann, but anytime we have a presentation, whether it's, to the local officials or any homeowners associations or churches or whatnot, we are putting all those presentations on the website as well. So we're, again, trying to ensure that this is a very, very transparent process. And anytime you need any information with regards to what we presented, it's available for the general public as well. So I will definitely send it out, but I will also send you a link to the website as well for future use. Thank you, everybody.
Thank
Do
you,
I need
Jack.
to turn? Sure. Do I need to turn it back over to you, Lizann?
Yes, please.
Okay.
And does anybody have any questions?
No, that's not right.
Any additional questions for Jacky? I also wanted to just mention that Commissioner Whiteley's was on the call earlier today. I believe he's still here. So this is your first meeting. We welcome you. Thank you for your interest in CGIC, and thank you for attending this morning. So we're going to move. We're going to move along to our next presenter, which is me. And I'm only going to take just a couple of moments to share that that we have been in the process of working through a grant. So last year, I wrote a piece of a grant that the Criminal Justice Coordinating Council was submitting to the Department of Justice to increase our capacities around behavioral health issues in our community. And so because we had already had the behavioral health unit grant, we were unable to extend that at that time because we still had funding for that grant. But what it did allow us to do was to go after funding to increase our capacities around connecting services together. And so we wrote a grant. The grant I submitted to them was funded, and it is for the development of a community data platform. And so I'm going to go back to here and then share my screen. So this is a slide from a community information exchange. So we're using those terms interchangeably. A community information exchange has a set of network partners. It has shared language. It has a resource database, which we've had through United Way 211 and also herohelpme.com that was provided through the CDC REACH grant. And then we have technology platform and data integration. And what this does is it allows us to have bi-directional referrals. So if you can think about the herohelpme.com database and then taking it to this next level so that partners within the community can share information with each other, and then they can make bi-directional referrals. So let's say Gateway is seeing someone through their outpatient services, and that person also needs food, or they might need some health care through Curtis V. Cooper or J.C. Lewis or another healthcare provider, and they might also need some assistance with housing or some other resource within the community. What could happen when we develop this is that case manager could make referrals over to other agencies in our community and make those direct referrals for that person specifically. We're headed towards having a HIPAA compliant platform so that those and different tiers within that platform that could allow sensitive information to be shared with agencies that have business associate agreements. And then the bigger part is it's going to help us do more community care. All of us know that's one of the places that we often misstep in making sure that when individuals interface, especially those who might be about to be in crisis or in crisis, is making sure that they're connecting from point A to point B, and sometimes even point C seamlessly and making sure that the most information is shared so that when they get from point A to point B, that information that is overlapped and that person is received and cared for. So that's the process that we're in. We're just beginning this. The grant funds have just come down. And so we'll start actually in the next 2 weeks with meetings. We're going to have a smaller meeting, and then we're going to bump it out to larger meetings. So what I would ask is that when we reach out to you, it's not if, it's when. When we reach out to you, we would really want your support, and we would want your feedback, because this will not be CGIC's platform. This will be a platform that will land somewhere with an agency in our community. It'll be, because the funds are coming into Chatham County, it will go through a process that will be fair. And so we want to make sure that we get your input, because this will be your data platform. Ultimately, that will work for the sake of individuals in our community who need our assistance. So if you have any questions, you can put them in the chat, or I can try to answer them now. Okay, thank you. Then we're moving along to our next presenter, Dr. Telfair.
Yes, I'm here. Can you hear me?
Yes, we can. Thank you for being here this morning. So, Dr. Telfair, if you would introduce yourself for those who may be new on the call and might not know you, and then I believe that Rachel will give you the capacity to share your screen.
All right, thank you. So good morning, everyone. So I'm Joseph Telfair. I'm the Associate Dean for Practice and Research in the Jinping Su College of Public Health at Georgia Southern University. And we cover all 3 campuses, with the Armstrong campus, with the Statesboro campus, and hang on. And with the Hinesville campus. So I'm sorry, go to meeting is not my primary area to work. So the screen sharing part, you're gonna have to walk me through this with the slides, Ms. Roberts.
There you go. You're up.
I'm up. Okay.
Yes.
So do you see a single screen or a double screen on that one? Okay, then I'll just go with this. So forgive me for being a bit of a not so skilled on this one. So we at Georgia Southern, as many of you know, we are pretty much, particularly in the College of Public Health, see our role as both as partners, as well as providing just services as best we can around training, evaluation, and so forth. So right now, what we have is that we have an opportunity. As you know, we presented a workshop not too long ago on grant writing, and now we had for a while been putting together discussion related to a program planning and evaluation workshop. And so we met, we being GCIC, CGIC, Healthy Savannah, and ourselves, and we have put together a plan that we would like you all to seriously consider participating in, which is our planning evaluation workshop. So why do we have it? So there's, we know that program planning and program planning, monitoring, evaluation is very critical. What we know is that all of us, particularly everybody on this call, has a program of one type or another. And one of the things that's really critical is we have accountability. So we all have accountability in more than one way, in the sense that we're reporting to those that we have responsibility to, but at the same time, our accountability has to do with our ability just to maintain and to grow and to develop. So we think that we have a focus on this program planning approach that we think will be effective in both understanding the program itself and how it works, and also in just improving the delivery process. And it is overall, when we look at more credit evaluation, we're looking at it both from the state and local levels. The other component, a second reason why we think this is very critical is, and particularly this particular workshop at this particular time, is that this is an opportunity to enhance the staff's understanding of what really contributes to which way, how, and so forth a program works, in terms of the specific aims, in terms of what it's trying to do, which is its targets, as well as what is it trying to understand, which is what its evaluation objectives are. And all of these are fairly critical in terms of how we would like the program to work. So our other big reason is that we live in a time where we have responsibilities, as I said before, not only to our constituents, but also to our staff, the people who work within our programs, as well as those who are contributing, those stakeholders, those who have a stake, those who have part of this and ownership in this. And we have that because we want to put in place something for determining whether or not the program is working as expected. So when people are supporting and providing resources, as we started out this call today with a call to support the Coastal Georgia Indicators Coalition, well, it's important for CGIC to also be able to feed back and give back to people who are contributing. And so whether or not the program is succeeding on that one. The other big piece of this is that programs exist, but services within programs also exist. And there's a real challenge because we ourselves really wanted to make sure that everybody has an opportunity to have equitable, not only just equal access, but equitable access to all kinds of services, and also that those services meet their needs. The challenge of it is, though, is that we have at some point need to determine whether or not the things that we put in place, say 5 years ago, still work, and new things that we're bringing in also works. And so the only way you're going to really know how to do that is that if you have built in a program to monitor the program itself, and then to evaluate the outcomes of that program. Basically, to answer the simple question, is the program succeeding as it really planned to do? So part of the reason we want to make sure that you all have this is that part of the learning. And then the other part is to help staff, stakeholders, and clients understand how the actual systems of care work. So Ms. Roberts talked about grants that allows you to build on previous work, and you've heard others talk about this. The 2040 plan is an excellent example of a systems level type of program that is overseeing multiple components, and each of these components are interrelated in such a way that they lead to the growth and function of that. And you also demonstrate the data, you can see the change that occurs, and it gives you some idea of whether something is working or not. So all of these things put together allows us to have a good understanding of what we do, why we do it, should we be doing it, and asking some critical questions about maintenance of the programs themselves, change in programs themselves, introduction of new things. And these programs are the usual components to that. So overall, why should you have a monitoring evaluation plan? Well, there's a couple of things that we who do this for a living and work with other people believe is true. It'll help us, each step of planning monitoring evaluation, it's a guide. It allows you to be able to really follow through and to really see how things work, and to walk you through how things work and help you to understand. It also helps you decide, between when you have so many things that you do. You have we on this coalition in general, we do a lot. There's a lot of stuff that goes on, and the challenge of it always is setting priorities and being able to decide and to sort through all the information and to work with what works, and then to keep people invested, keep our stakeholders really there, and to also understand how are we meeting the needs of our stakeholders and our clients and our partners. It also keeps us from wasting time gathering information that we really don't need, and that's really easy to do. To just put together a lot of information, and what do you do with that information? And it helps us to streamline that. It helps us to see what we need, what we don't need, and then how to use that information, and then to be able to really give feedback to help us with that work. It also helps us identify the best possible methods and strategies for getting this information to the right people at the right time, and also teaching them and walking them through how they best can use that information to support their own efforts, and to assess whether their own efforts are being carried out. It's really pretty straightforward, for us who do this for a living, to figure out how to best use what data and what information we have. It is not as easy for those where data itself is novel in some ways, not as familiar in some ways, and is new in some ways. And so by putting together a simple monitoring evaluation plan that can be used, that can be an asset to, say, systems level programs, to put together needs assessment efforts, compliance efforts, you name it. All of these things are necessary to keep us going, but a lot of times people are focused a lot on the services and not as much on the outcomes per se, as in terms of delivering the services. While we know that those that provide and oversee what we do are interested in the bigger picture as well, not just the delivery of services, but all those delivery of services working out as they should. So it really helps us then to come up with a reasonable and realistic timeline for assessing this work and putting it together. And importantly, it helps us use this evaluation to prove the project along the way. The other big thing that it does in all of these things is that because it helps us through the programs on the way, it also provides us with information that allows us to go after additional support and funding and programs. And as you saw earlier, Ms. Roberts presented an existing program, and then that because you have that existing program, she can go after additional monies. And we've seen that pretty much through this last year in particular. Those that have programs have been able to expand and grow those programs despite the challenges that COVID has presented. They have been able to take advantage of that because we have both data, we have monitoring data, not just the numbers, but we also have the other types of qualitative evidence, and we also have the work that's done. So we believe very strongly that this skill set that will come, that we know people, not just skill set, we know people get from this work will be important. So what's our plan? So right now we are looking at say early fall of 2021. We want to take monitoring evaluation and provide you with a context. A lot of times when we talk about monitoring evaluation, we just talk about the numbers and that sort of thing. However, we are very much believing that this type of work itself is something where it enhances our community of practice. What we mean by that is it helps us to build on the knowledge and the skills of the existing staff, existing agencies and programs. And it is also very attractive to funders because if you have built into the work that you do an overarching approach that allows you to basically have monitoring and evaluation for every service that you provide. So if you have a service, there is some way to assess the efficacy of that service and outcomes of that service. And that is part of your routine. That is not something that you do just to satisfy the grant. It is something that you build into your practice, into the work that you do. It becomes a part of everything that you have. So our overarching goal is to just impart basic skills so that pretty much everyone will have at least a person at their agency who has basic monitoring evaluation skills. So that's kind of what we mean. And so when we mean by community practice, we mean that this is built in to the work that you do, independent of the type of program that you have. So we will have a workshop that we think will be interactive, and we propose a two-phase approach to this. The first part in the early fall is the in-person participatory approach that is basically the teaching and the training and the development part. which will have both, the information that will be imparted to you and also give you a chance to practice, give you some hands-on methods. For example, bringing an application that you have and then walking you through how to build a mounting evaluation plan around that application and so forth. The second part of it is the next phase, which is the follow-up after that. And this first phase, by the way, we'd see as somewhere around a 4 to 6 week type of one day a week training, sort of, if it will, or some other format. We haven't quite worked it out yet, and I'll let Ms. Roberts and Ms. Kressler speak up on that part. The other part is a recommendation that has come up in the work that we have in terms of the workshop, was that one of the things that happens a lot is that people come and they participate in the workshop, and when they do what they do, they walk away from it, and then there's no, we're not sure what happens. And so one of the things that we're going to have is that we're going to build in a follow-up, and this is a consultation, if you will, one-to-one or one-to-many type of follow-up that's unique to the different agencies and programs, and that is very specific to the type of evaluation that you built in. And this will be a follow-up. It'll be open to those that volunteer to have us. Once the workshop's over, then we would schedule times to come and meet and walk through challenges that people have implementing this work and so forth. So we see this workshop as both an in-person, one big one, if you will, and then an individual one-to-one follow-up. So we think it roughly will be a 4-week training, somewhere in there. And the other part of it is that we want to provide a certificate that indicates that you successfully completed this program and that you have met the requirements for the requisite knowledge and skills work, and that we would like at least one person for each agency to have this certificate, and they will follow up. And then we discussed, and I'll let Ms. Chrysler talk about this part, but she is looking at those who have subcontracts with her to have an MOU, in their MOU, that they went through this training and they maintain this training. So Ms. Chrysler, if you want to speak to that, I'll turn it over to you.
Thanks, Dr. Telfair. No, I think that, we just briefly talk about all of this. And so we've got more conversations to have with our immediate team and what that looks like. But just if you are with the Racial and Ethnic Approaches to Community Health Grant and you are funded through the CDC funding as part of that, then we are, as you know, we've been looking at sustainability this year, year 3, and so next year is year 4, and then of course we have one more year, year 5. So look for more on that. We'll look for your insight onto how we deliver the training and all of that goes with that. But we're excited that Georgia Southern and Coastal Georgia Indicators Coalition, I mean, this is professional grade level that we feel like we should absolutely take advantage of and make it a really awesome thing for Chatham County and our residents in a real policy and systems change arena, along with just increasing just the, I guess, the results of the programs that are out there for our community. So that's it. Lizann, would you want to add any more?
Thank you, Dr. Telfair and Paula. I would say that, one of the things that we've noticed through our work is that when we pay attention to evaluation and we include that evaluation work in future proposals, that's what strengthens proposals. And we want to make sure that everyone that wants to take part in this has the opportunity. So if you're feeling inclined already to be a part of this, I think a beautiful part of it is that you'll actually get a certificate that says that you've completed the course. But the bigger piece is that you'll get this, I think, really solid foundation in evaluation and planning that will help further all of our work in the community. So I can't thank Dr. Telfair enough for contacting us, having the conversations around how we could do this, and then bringing in other partners with Healthy Savannah. And I think that as we look at other agencies within our community who are funding work, I think it's important for all of us to be on the same page. So thank you again. And does anyone have any questions for Dr. Telfair or Paula or me regarding this? So thank you again, Dr. Telfair.
We have a question from somebody, Whitley or Whiteley? I'm sorry. Yeah, Whitley.
Is there any room for Savannah State in this study?
It's not a study.
Yeah, so it's not a study. It will be an evaluation program. I think that if Savannah State wanted to be a part of our of the work, we could certainly connect. If you have a recommendation, Commissioner Whiteley, if you would have a recommendation on who we would contact from Savannah State, we would certainly welcome their participation. Any other questions? So Gina Taylor is asking, is it specific to organizations that are part of the grant that Paula described? No, it is not. It is not specifically for those organizations. It is for any organization that is in our community who would like to participate. We're planning, I think, to have part of it. Unless we have a huge rise in COVID, I think we're wanting to have part of it in person, and so that we can reclaim some of the richness that we have about being in person with each other. And right now there is not a cost for being a part of it. So thank you, Patricia Merritt, for asking that question.
Yeah. So a couple of things too to keep in mind. I'm glad people are asking this. So one of the things is that, so forgive me, I think I may have caught Ms. Kreisler off guard a bit, because so my apologies to that. Part of this is that we still are in the 3/4 of the planning we've kind of put together, but there's a couple components to it that we know we're going to have to work out. The other bit though is that, and one of those I want to say is that we are looking, and I had put in a request, if we could reach out to the counties and the programs and agencies and so forth of the counties that are in the catchment area of Chatham. So, there's a lot of other counties, including our own in Bullock, who have agencies that could benefit from the level of training. We haven't quite worked out the details of that yet. So I would say that if you all, have those contacts, particularly in the rural counties that usually receive very little or no support for this type of work, type of effort, but could benefit greatly from it, we really would try to do this. And so I've asked, because Georgia Southern, particularly our college, we ourselves are committed to growing, to dealing with inequities that exist, rural inequities in particular that exist, and that if we can do our little bit, which is provide this sort of high-level professional training to those counties for free, via whatever mechanisms we can, we want to be able to do that. So we want to give them that opportunity. So if y'all know of these agencies, and I will try to work with Ms. Roberts and others to reach out to a lot of these agencies in these counties in particular, to consider this training. We want to do that. So if y'all can help us identify persons and or agencies that we can reach out to and make sure that they know about this training when we put it together, appreciate that tremendously. And I think Ms. Roberts, we did we had that discussion. I don't know if we've agreed pretty much on it, but I put that in as a request from us in particular. And I know part of the work that Ms. Chrysler's team does in dealing with inequities is to try to address rural inequities as well, if I remember correctly.
Yeah, this is Linda. I can try to hook you up with some contacts for that.
That'll be great, ma'am. Thank you.
Okay.
Was there another? There was another question that popped up. I'm sorry. There were a couple actually, Ms. Roberts.
So there, Dr. Small said there may be agencies that seek funding through United Way that may benefit from this type of training and support. Thank you, Dr. Smalls, for that. And we're just, we wanted to get this out as soon as we could to all of you. So we'll make sure that we connect with United Way to make sure that this is available to all the agencies that they fund. And I would say that, this would be also, applicable to agencies that the county funds and that the city funds, all of those different agencies that receive funding could benefit from this type of training. And we want to make sure that we get it out to those people. So you're getting the first, everybody on the call this morning is getting the first blush of this this morning. So Patricia Merritt asked if there was a cost. No, there's not a cost. What I would ask though is that you treat it like there's a cost, because we want you to truly, this is a great value that we're bringing to our community. And Dr. Telfair is at the top of his game. We are so grateful to have Dr. Telfair and Georgia Southern University to be a part of this, and so we'll continue to work alongside and give you guys updates and push information out to you. So if are there any other questions before we move ahead?
There was one from Ms. Trice, I think, about the information. Yeah, we will definitely pass this on as we work on this. And so the three of us need to meet Ms. Chrysler and Ms. Roberts, and then we will be including getting information from others on how best to roll this out. Because what we, that the challenge of it is that I've been doing this for like 30 some years and doing it in all kinds of settings. So it's a challenge of how to kind of make it fit so that it meets the greatest needs. And our biggest challenge, of course,
Hey,
we
good
know.
morning. How are you?
Hi, good morning.
I'm sorry.
I'm sorry for the.
Yeah, we will. Our biggest challenge is going to be reaching out and including the other counties that are in the catchment area, because we know that within the city and the county, it's within Savannah City and Chatham County, there's a lot of networks there, but in these other areas, we know that that's a challenge. So we're going to need help for people who reach out regionally. And so we're going to do that. And the rest of it is how to include those regional persons, but also how to make it work for everyone who wants to provide this and do this. Our biggest question comes all the time is that, do we have a cap on the number of participants? We don't know that yet because of the venue, how we do that. We also, because everything is going to be, the materials are going to be electronic and so forth. So we have all those kind of logistical things to work out. But since we've done this so many times, it's just a matter of adapting that information to what we need to do. And we hope by maybe the next meeting, we'll have more detail.
Okay. Thank you, Dr. Telfair.
Okay. All right. Thank you.
We'll move along. So Rachel, if you could pull up.
Yeah, can I?
We're getting close to time. Yeah.
All right.
Thank you.
Yeah, thank you.
So we've got partner highlights coming up, but I wanted just to note that the quality of life team is June 30. The health team will meet on June 17th. the education team on June 6th, and then economy on July 13th. And we're still continuing to meet, though, about updating the blueprint. If you're not on one of these teams and you would like to be, please reach out to Rachel and me to discuss that, and so that we can add you on. If you could unmute yourselves, and I'm going to show as we're moving on the partner highlights. I was able to, Paula Chrysler sent me the video of what we were trying to see earlier. I'm going to see if I can play it. So I'm going to share my screen, and this is a 30-second video. Let's cross our fingers and toes.
Hey, you. Yeah, you. Stop casually scrolling through TikTok and pay attention. Tired of restrictions on all the fun things we used to do? Instead of going to football games, we're watching the game on Hulu. The only way we stop the virus and get back to normal is by knowing the facts, like the ones on your screen right now, and getting our vax. I got mine. What are you waiting for? Get your vaccine now. Unless it's 1 in the morning, then just make an appointment online before you go to bed. Now, back to the episode of Supermarket Sweetie you've seen 15 times. Seriously, get your vaccine.
So just real quick, Lizann, that was the one that's running on the Know the Facts, Get Your Vax campaign, which is completely different. But did you get the link for the one with Nichele and Elsie as well? It should be in your email. That was, so I sent you 2.
Hold on just a second.
All right, and just a little context there. Obviously, that was trying to address that big gap that was described earlier by Tammi on the youth. So the campaign is a combination of the city, the county, Healthy Savannah, Gulfstream, Hospice, Health Department, and in-market to try to, again, to just do, it's a very short-term campaign that's called Know the Facts, Get Your Vax, and we're hoping to get a big bump in that younger crowd. Oops, sorry.
Paula, was that our own Armand Turner in that wonderful video?
When I say R, you say.
Oh, that's what I'm talking about. What? Oh, a star is born every day. Way to go, Armand. Love it.
Unfortunately, I have to have access. I can't get in because you sent it up to me on Google Drive, and I can't get access to it, Paula. You'd have to send it to me a different way.
All right, well, we tried, but it is a great video of Elsie and Nichele and reaching out, trying to get those trusted voices. We will work to get those technical challenges worked out, but it was just, it's a pretty awesome video too in all of this space. But
all right.
So
thank you. So if you'd send it to us, we'll make sure it goes out with the updates. So folks, I know you've got updates. Please go ahead before I call on you.
Well, thank you for asking, Lizann. So just wanted to remind everyone, this is Maureen McFadden with Gateway, and September 11th is our set in stone date for our car show, where we're going to have a wonderful car show with over 200 cars and also work towards destigmatizing mental illness. So we hope that all of you will be able to be vendors there. It's free to be a vendor, and we'll send out information on that, but please save the date for September 11th. And it'll be at the parking lot at Tanger Outlets.
Awesome.
Hey, Lizann, this is Tammi. On July 15th and July 29th, we'll be offering free hearing, vision, dental, and nutrition screenings at the Eisenhower Health Department.
Thank you. And if you have anything that you could send to me Tammi, that shows that information that we could send out, we'll be happy to send it out to everyone. Thank you.
Yes, ma'am.
Morning, Lizann, Reginald.
Hi, Reginald.
Good morning, everyone. I continue to be pleased to report progress on our oral health adult dental clinic that will be August 28th and 29th at the Garden City Recreation Center. Many of you have received flyers and information. We have updated that flyer with some corrected times. So Lizann, I'll make sure you get those flyers, and if you would help us get those out to this group, it would be appreciated. We are also hoping to connect the vaccine clinic to this event, and thank you, Tammi, for sending me course information. We'll try to move forward with coordinating that as well. We're continuing to look for or invite organizations that would like to share information at the clinic. We are anticipating and can handle between 300 and 400 City of Savannah or Chatham County residents only for that event. We are also, the Planning Council is having our full council stakeholder meeting next Tuesday. We will be sharing information on the results of our survey that we send out, and thank you for those who responded. We did get some good feedback in terms of the perceptions of the community about the Planning Council's role in coordinating safety net services with our safety net partners. We are also continuing to conduct safety and resilience training. We do have upcoming trainings for mindful self-compassion and trauma-sensitive interactions. Vera just completed, I'm not sure if she's on the line now, she was earlier, but she did complete over the weekend a trauma-sensitive yoga training and certified, I think, about 12 yoga instructors to address yoga in a trauma-sensitive way. They have also developed a coalition for that group. So again, if anybody's interested in learning more about the trauma-sensitive yoga, you can reach out to Vera at the Planning Council. And then finally, at our full council meeting on Tuesday, we will be talking with Chatham EMS. There are just tremendous concern about the non-emergency calls that they are having to deal with that are tying up units in the community. So we will be sharing information and hopefully brainstorming some potential solutions to that problem. So that's all I have. Again, if anybody's interested in being a vendor at our dental clinic in August, feel free to reach out to me here at the Planning Council. Thank you.
Thank you, Reginald. So Kayla Brown put several links over in the chat. There, the Truman Linear Park Trail cleanup is this Saturday. There's a link. And then another. So Sherry Trice, are you on? I am sending you an unmute request. There we go. Hi, Sherry, can you say something? I don't think your audio is working. Okay, so I do want to say that we completed Sherry and Greenbrier is part of Greenbrier, and they completed a community transformation grant that would allow for some additional trauma responsive training in the community, especially for those who serve children 0 to 5 years of age. And so that was completed. I'm not sure exactly when they're expected to hear back about that, but we'll keep you updated on that. Are there any other updates?
Hi, Lizann, this is Maya. Juvenile Court is hosting a community and job resource fair That's going to be held on June 11th from 11 to 2 p.m. It's a combination of resources for the community, not just for youth, but for families. And it will be located at Juvenile Court's parking lot. So just ask anybody to come. Everybody's invited.
Do you want to give that date again?
It's June 11th.
And what
from
time?
11 to 2 p.m.
Okay, June
It's
11th.
a job and resource fair for the community.
Okay, thank you very much.
Thank you.
Lizann, this is Beatrice.
Hi, Beatrice.
How are you? And so excited to share again that we are going to have a Hispanic community clinic vaccination this Saturday, June 5th at MedBank. Thank you to Tammi Brown and CORE for the unconditional support. We are very excited to report that at the last event, we administered 73 vaccines in 3 hours. So
Wow.
we were super excited. And because of that, we are going to continue scheduling every 3 weeks in order to ensure that the attendees are going to be attending the same site for the second dose. So we are very excited in June. So we're going to have June 5th and then June 26th. But I'm going to forward to you the flyer for June 5th. That is the one that is upcoming. And then later on, I will send you the 26th. And thank you to Reginald. Also, we have been able to give away 100 bags of oral care with flyers for the dental clinic. So it is just how the community working together can make a great difference for all of us.
Thank you, Beatrice. And thank you for the work that you do. It's awesome. Patricia.
Good morning, Lizann. This is Patricia Merritt with Chatham Juvenile Court. I did want to introduce everyone to our new front porch director, Miss Ann Robinson. I'm quite sure in the coming days, weeks, and months that you all will get the opportunity to meet Miss Robinson in person. Ms. Robinson started on June 1, that was yesterday, and she's already worked with us to develop some fun and exciting activities for the summer at the front porch. We are particularly excited to kick off the summer with a joint project with Parent University, and we will definitely get that information out to everyone. We would like to first share it with our IOG board on next Tuesday. And then after that, we will get that information to maybe to you, Lizann, so that you could send it out to all of the CGIC partners. And thank you, Maya, for giving the information regarding the Job and Community Resource Fair. We're excited about that as well. And again, that date is June 11th. From 11 a.m. to 2 p.m. in the parking lot at the Chatham County Juvenile Court.
Okay, thank you, Patricia, and absolutely we'll get that information out. Coco, I saw you unmiked.
Hey everyone. So Deep Center is hiring. We currently have an open position for a youth community organizer who will be working with young people ages 17 to 26. The deadline is June 25th. We also will have like a number of positions opening up this summer, probably mid-summer, like late July, that we'll keep posted with. But if you know of a young person who preferably has been systems involved or has been justice impacted, we would encourage you to encourage them to apply for the position. And again, the deadline is June 25th.
Thank you, Coco. Sherry Trice also put in the chat that they're hiring early childhood education teachers, and she put the contact information over there. Any other updates? Okay. I am not going to keep you guys on for an update with me from the director's report. I'll send out a short synopsis of that. If you have any questions or comments to me, please, you know how to find me. Please do. And thank everybody for being on the call today. I'm wishing you good health and stay cool out there in the summer heat. And if you've not gotten connected with one of our smaller priority teams and would like to be a part of that, please reach out to us. And you guys take care. You are the reason that we do what we do. And so we're very appreciative of all that you do for our beloved community. Thank you. Bye-bye.